What if I told you that one of the vegetables sitting in your kitchen right now, the one you've probably been told is healthy, could actually raise your stroke risk almost overnight? I know that sounds dramatic. It sounds like clickbait, but stay with me because what I'm about to share might completely change how you look at your dinner plate. We've been conditioned to believe that all vegetables are automatically good. Green equals healthy, crunchy equals safe. If it comes from the earth, it must protect your heart, right? But here's the uncomfortable truth. Not all vegetables affect your body the same way. And in certain people, under certain conditions, one very common vegetable can spike blood pressure, increase inflammation, and potentially raise stroke risk faster than you think. Before you panic and throw everything out of your fridge, let me be clear. This is not about demonizing vegetables. It's about understanding context. It's about understanding your body. And it's about knowing how something that seems harmless can quietly become harmful. Let's talk about what actually causes most strokes. The majority of strokes are either ischemic, meaning a blood clot blocks blood flow to the brain, or hemorrhagic, meaning a blood vessel ruptures. Both types are strongly linked to high blood pressure, inflammation, arterial damage, and blood vessel stiffness. So when we're talking about raising stroke risk overnight, what we really mean is this: something that sharply spikes blood pressure or dramatically increases vascular stress in a short period of time. Now, here's where it gets interesting. There's a vegetable that's often served in restaurants, added to salads, mixed into soups, and even promoted as heart healthy. But when it's prepared a certain way and consumed in excess, especially by people over 50 or those already dealing with hypertension, it can create a perfect storm inside your blood vessels. I'm talking about heavily salted, pickled, or preserved vegetables, especially pickled cabbage, fermented vegetables loaded with sodium, and certain canned vegetable products. And yes, that includes things like sauerkraut, kimchi, pickled cucumbers, and even canned tomato products when they're packed with salt. Now wait, before you say, but I thought fermented foods were good for you, let's slow down and unpack this. Fermented vegetables themselves aren't the villain. In fact, naturally fermented vegetables without excessive sodium can support gut health. The problem is the sodium load. Many commercially prepared pickled vegetables contain staggering amounts of salt. One serving can contain 600, 800, even over 1,000 milligrams of sodium. That's nearly half or more of the recommended daily intake for someone with high blood pressure. Imagine this scenario. You wake up in the morning, your blood pressure is relatively controlled. You have a sandwich with pickles at lunch, maybe some canned soup with salted vegetables, and a side of kimchi at dinner. You don't think twice about it because it's vegetables, but by the end of the day, your sodium intake has doubled or even tripled what your body can comfortably handle. Sodium pulls water into your bloodstream. More fluid means more pressure against your artery walls. If your arteries are already stiff from age, stress, or plaque buildup, that sudden increase in pressure can strain them dramatically. In someone vulnerable, that spike can trigger a hypertensive crisis. And that is when stroke risk skyrockets. Doctors are often shocked when patients who eat healthy still experience sudden blood pressure surges. When they dig deeper, they find hidden sodium bombs disguised as vegetables. Here's what most people don't realize. As we age, our kidneys become less efficient at excreting excess sodium. Our blood vessels lose elasticity. The same amount of salt that your body handled easily at 30 can have a completely different impact at 60. It's not just about what you eat, it's about how your body handles it now. There's also another layer to this story. Some preserved vegetables contain added sugars and chemical preservatives. These compounds can increase oxidative stress and inflammation. Chronic inflammation damages the lining of your blood vessels, known as the endothelium. When that lining is damaged, plaque builds more easily. Clots form more readily, and that's a direct pathway to stroke. Now let's talk about blood pressure spikes specifically. Studies have shown that in salt-sensitive individuals, a single high-sodium meal can raise systolic blood pressure by 10 to 20 points within hours. Not days, hours. That means if you're normally at 130, you could suddenly be at 150 or higher. If you're already borderline hypertensive, that jump can push you into dangerous territory quickly. And here's the scary part. You don't feel it happening. High blood pressure is called the silent killer for a reason. You don't get a warning alarm, no flashing red light. You just go about your day while your arteries are under intense strain. I've seen people who proudly say, "Oh, I don't eat junk food. I eat vegetables every day." And that's fantastic. But when we look closer, many of those vegetables are coming from cans, jars, and processed containers. The sodium content is through the roof. Let's bring this even closer to home. Imagine someone over 55 with mild hypertension. They start a healthy eating plan. They add vegetable juice cocktails, canned vegetable soups, pickled beets, olives, and fermented cabbage to their meals. Within a week, their blood pressure readings are consistently higher. They're confused, they're frustrated, they think something is wrong with their medication. But the real issue? Hidden sodium. And sodium isn't the only concern. Some vegetables, particularly when fried or heavily cooked in unhealthy oils, can create compounds that promote oxidative stress. Deep-fried eggplant, battered zucchini, or vegetable fritters might sound plant-based, but when cooked in oxidized oils, they become inflammatory triggers. Inflammation thickens the blood, increases clotting risk, and stiffens arteries. Combine that with high sodium and dehydration, and you've got a recipe for vascular disaster. Another overlooked issue is potassium balance. Fresh vegetables are naturally rich in potassium, which helps counteract sodium's effects. But when vegetables are processed, canned, or brined, potassium levels often drop while sodium skyrockets. That imbalance further disrupts blood pressure regulation. So what's the takeaway here? It's not vegetables are bad. It's that the form matters, the preparation matters, the quantity matters, and your personal health profile matters most. If you have high blood pressure, kidney issues, or a family history of stroke, you need to be especially cautious with sodium-heavy vegetable products. Read labels. If a serving has more than 200 milligrams of sodium, be mindful. If it has 500 or more, treat it as an occasional indulgence, not a daily staple. Fresh vegetables, steamed, roasted without excess salt, lightly sautéed in healthy oils, are still incredibly protective. Leafy greens like spinach and kale provide magnesium and potassium, which relax blood vessels. Beets contain nitrates that improve circulation. Broccoli offers antioxidants that protect arterial walls. But when those same vegetables are drenched in salt or processed to extend shelf life, their protective power can be overshadowed. Let me also address something important. Stroke risk is cumulative. It's not usually one meal, it's patterns. But in a vulnerable person, a sharp blood pressure surge can be the tipping point. Think of it like bending a paperclip. One bend doesn't break it, but repeated stress weakens it. Eventually, one more bend snaps it. Your arteries are similar. Chronic high sodium intake weakens the system. Then one particularly salty day pushes it over the edge. I want you to think about your last grocery trip. How many vegetables did you buy fresh? And how many came in a can or jar? No judgment, just awareness, because awareness is power. There's also a cultural aspect. In many cuisines, pickled vegetables are traditional and beloved. They add flavor and preserve food. But historically, people were more physically active. They sweated more. They consumed fewer processed foods overall. Today, we're more sedentary and already overloaded with hidden sodium from bread, sauces, and packaged foods. Adding high sodium vegetables on top of that compounds the issue. Let's also talk about portion distortion. A serving of pickled vegetables is often just 2 tablespoons, but who actually measures that? Most people scoop generously onto their plate, unknowingly consuming 2 or 3 servings in one sitting. And then there's the health halo effect. If something is labeled organic, fermented, or probiotic, we assume it's automatically safe in unlimited amounts. But even healthy things can become harmful in excess. I want you to imagine your blood vessels as delicate garden hoses. When pressure builds too high, weak spots can burst. The brain is especially sensitive because its blood vessels are small and intricate. A sudden spike in pressure can cause a tiny vessel to rupture, leading to hemorrhagic stroke, or high pressure can dislodge plaque, forming a clot that blocks blood flow. The overnight risk doesn't mean you eat one pickle and collapse. It means that in the wrong body, at the wrong time, under the wrong conditions, a sudden sodium surge can create dangerous instability. So what should you do starting today? First, check your blood pressure regularly. Knowledge is protection. Second, prioritize fresh vegetables over canned or brined ones. Third, if you enjoy fermented vegetables, choose low-sodium versions or make your own at home where you control the salt. Hydration also plays a role. Proper water intake helps your kidneys flush excess sodium. Potassium-rich foods like avocados, spinach, and sweet potatoes help restore balance. And most importantly, personalize your nutrition. What works for one person may not work for you. If you've ever noticed headaches, swelling, or sudden blood pressure jumps after salty meals, that's your body talking. Doctors are shocked not because vegetables are evil, but because the nuance gets lost. People think they're doing everything right, yet hidden factors quietly undermine their health. Your mission isn't to fear food, it's to understand it, to respect its power, to recognize that even something as innocent as a vegetable can have a dark side when processed and overloaded with sodium. If this opened your eyes, I want you to take a moment and reflect on your pantry. Awareness today can prevent a crisis tomorrow, because protecting your brain and your heart isn't about perfection. It's about informed choices, small adjustments, and consistent habits that keep your blood vessels calm, flexible, and strong. And that's how you truly lower your stroke risk, not by avoiding vegetables, but by choosing them wisely, preparing them thoughtfully, and listening closely to what your body is telling you every single day. Let's talk about something that almost nobody explains clearly, and yet it affects thousands of people every single day. You've probably heard that leafy greens are some of the healthiest foods on the planet. Spinach, kale, collard greens, Swiss chard. They're loaded with nutrients, antioxidants, fiber, minerals, and one very powerful vitamin called vitamin K. For most people, that's a great thing. But if you're taking blood-thinning medication, especially medications like Warfarin, extremely high intake of vitamin K-rich vegetables can quietly interfere with how your medication works. And in some cases, that interference can increase stroke risk instead of lowering it. Now, I want to be very clear from the start. This is not about saying vegetables are bad. It's not about scaring you away from greens. It's about understanding balance, consistency, and how your medication interacts with what you eat. Because when it comes to blood thinners, consistency is everything. If you or someone you love has atrial fibrillation, a mechanical heart valve, a history of blood clots, deep vein thrombosis, pulmonary embolism, or prior stroke, there's a high chance a doctor has prescribed a blood-thinning medication. The goal of these medications is simple: reduce the blood's ability to clot too easily, because when blood clots form where they shouldn't, especially in the heart or arteries leading to the brain, that's when strokes happen. Warfarin, one of the most commonly prescribed anticoagulants for decades, works by blocking the action of vitamin K in the liver. Vitamin K plays a central role in activating clotting factors, proteins that help your blood clot. Without enough active vitamin K, your body produces fewer clotting factors and your blood becomes thinner, meaning it takes longer to clot. Now, here's where the problem starts. If you suddenly flood your system with very large amounts of vitamin K from food, you essentially counteract the medication. You give your body more of the very nutrient that the drug is trying to limit. That means your clotting factors can become more active again. Your blood may clot more easily, and if you're taking the medication specifically to prevent clots that could cause a stroke, that's a serious issue. Imagine this scenario. Someone has been on Warfarin for months. Their INR, that's the blood test that measures how long it takes blood to clot, is stable. Their dosage is carefully calibrated. Everything looks controlled. Then they decide to get healthy. They start drinking green smoothies every morning packed with kale and spinach. They add large salads to lunch. They snack on broccoli and Brussels sprouts. All of those foods are incredibly healthy in general, but they are also extremely high in vitamin K. Within days or weeks, their INR drops. That means their blood is clotting faster than it should while on medication. If they don't get tested quickly enough, they may not even realize the shift has happened. Their doctor might be confused about why their numbers changed. Meanwhile, the protective effect of the blood thinner is reduced. And in someone with atrial fibrillation, for example, where irregular heart rhythms can cause blood to pool and clot inside the heart, that reduced protection could allow a clot to form. If that clot travels to the brain, it can block an artery and cause an ischemic stroke. This is why doctors don't tell patients on warfarin to avoid vitamin K completely. That's a myth. Yeah, they tell them to keep their intake consistent. The problem isn't eating spinach. The problem is eating drastically different amounts from week to week. Vitamin K is fat soluble, meaning it's stored in the body and absorbed along with dietary fat. When you eat a large serving of kale sautéed in olive oil, you're not just getting a small dose, you're absorbing a concentrated amount. Kale is one of the richest sources of vitamin K available in food. A single cup of cooked kale can contain several times the recommended daily intake of vitamin K for the average adult. Now, for someone not on blood thinners, that's generally beneficial. Vitamin K supports bone health, proper clotting when needed, and even vascular health in certain contexts. But for someone whose medication depends on tightly regulating clotting factors, that sudden surge matters. What makes this even more complicated is that many patients are not educated deeply enough about food-drug interactions. They might be told, watch your greens, but that's vague. Does that mean avoid them? Eat less? Eat the same amount every day? Some people become afraid of vegetables altogether. Others ignore the advice completely because they assume healthy foods can't possibly cause harm. Consistency is the key word. If you eat 1 cup of spinach every day and your doctor adjusts your warfarin dose around that intake, that's fine. The body adapts. The medication is calibrated. But if you eat no greens for weeks and then suddenly consume massive quantities during a health kick, you destabilize that balance. There's also the issue of supplements. Some people take vitamin K supplements without realizing the impact. Others consume green powders, superfood blends, or concentrated vegetable extracts. These products can deliver very high doses of vitamin K in small amounts. And because they're marketed as health boosters, people often assume more is better. Let's talk about how this imbalance actually increases stroke risk. Warfarin works within a narrow therapeutic window. Too little anticoagulation and clots can form. Too much and you risk bleeding. That's why regular INR monitoring is critical. If vitamin K intake rises sharply, INR drops. Lower INR means thicker blood relative to the medication's intended effect. In someone with atrial fibrillation, blood swirls irregularly in the atria. That turbulence can lead to clot formation. The anticoagulant is there to prevent those clots from forming or enlarging. But if the medication's effect is weakened by excessive vitamin K intake, the clot prevention barrier becomes thinner. What's especially concerning is that the effect can happen relatively quickly. INR levels can shift within days of dietary changes. A person might feel completely fine while their clotting risk is silently increasing. Another layer to this is patient variability. Not everyone responds to vitamin K the same way. Genetics play a role. liver function plays a role. Overall diet patterns play a role. Two people could eat the same amount of kale and have different INR responses. There are also other vitamin K-rich vegetables beyond the obvious leafy greens. Broccoli, Brussels sprouts, cabbage, collard greens, mustard greens, parsley, and even certain lettuce varieties contain significant amounts. The darker and leafier the vegetable, generally the higher the vitamin K content. Fermented foods like natto are extremely high in vitamin K2. While K2 behaves somewhat differently from K1, it still participates in clotting processes. Large amounts could influence anticoagulation therapy. It's also important to recognize that some newer anticoagulants, often called DOACs or direct oral anticoagulants such as apixaban or rivaroxaban, are less affected by vitamin K intake. These medications work through different mechanisms and don't directly depend on blocking vitamin K. However, many patients worldwide are still on warfarin due to cost, specific medical conditions, or long-term stability. For patients on warfarin, the relationship between diet and medication is intimate and ongoing. That's why education matters so much. A sudden shift toward extremely high vegetable intake might seem like a positive lifestyle change, but if it's not coordinated with medical supervision, it can unintentionally undermine therapy. There's also a psychological component. Many people feel empowered when they overhaul their diet. They add green juices, salads, and detox regimens. They may not mention these changes to their healthcare provider because they view them as harmless. But in the context of anticoagulation therapy, these changes are medically significant. Another important detail is that vitamin K doesn't just affect clotting factors 2, 7, 9, and X, which are central to coagulation. It also influences proteins C and S, which are natural anticoagulants in the body. The system is complex and delicately balanced. When you alter one part of the system abruptly, the ripple effects can be unpredictable. Let's imagine someone who has had a previous stroke due to atrial fibrillation. They are placed on warfarin to prevent recurrence. They are stable for years. Then they decide to join a plant-based challenge, dramatically increasing their intake of leafy greens and cruciferous vegetables. They feel better overall, more energy, better digestion, but their INR quietly drops below therapeutic range. Weeks later, they experience another ischemic event. When doctors review their labs, they find subtherapeutic anticoagulation. When they review their history, they discover the dietary shift. This is not hypothetical, it happens. The tragedy is that the vegetables themselves are not the enemy. The issue is mismatch and lack of coordination. If that same patient had informed their healthcare provider, their warfarin dose could have been adjusted accordingly. Monitoring could have been increased during the dietary transition. Risk could have been minimized. Another overlooked issue is fluctuating appetite. Illness, stress, travel, or seasonal eating patterns can cause vitamin K intake to vary widely. Holidays might bring large servings of greens. A week of takeout might reduce intake dramatically. Each fluctuation can shift INR levels. Hydration status can also influence blood viscosity and lab results. Alcohol consumption interacts with warfarin metabolism. Liver health changes drug clearance. All of these factors interact with vitamin K intake in a complex web. In some patients, especially older adults, kidney function and liver function decline with age. Medication metabolism becomes less predictable. Appetite changes. Dentition issues may limit vegetable intake, then suddenly improve with dental treatment, leading to increased consumption. Each change matters. The concept of extremely high intake is relative. For someone accustomed to minimal greens, jumping to multiple large servings daily represents a dramatic increase. Even healthy cooking shows and online influencers encourage adding handfuls of spinach to smoothies, doubling salad portions, and stacking greens on every plate. For the general population, that advice may be beneficial. For someone on vitamin K-dependent anticoagulation, it requires caution and planning. There's also a misunderstanding about vitamin K deficiency. Some patients think they should eliminate vitamin K to make their medication stronger. That is not correct and can be dangerous. Severely restricting vitamin K can make INR unstable and increase bleeding risk. The goal is not elimination, it is stability. Think of it like a thermostat. The medication and vitamin K intake work together to maintain a stable internal environment. If one side swings dramatically, the balance is lost. Stroke risk increases when anticoagulation is insufficient. Bleeding risk increases when anticoagulation is excessive. Patients and providers walk a tightrope between these two risks. That's why dietary awareness is so crucial. Even herbal products can complicate the picture. Green tea contains small amounts of vitamin K. Certain multivitamins include it. Nutrition bars fortified with greens may contribute unexpectedly. Reading labels becomes an essential skill. In hospital settings, dietitians often coordinate meals carefully for patients on warfarin. But once patients return home, that oversight disappears. Education becomes the primary defense. The bottom line is this: extremely high intake of vitamin K-rich vegetables can interfere with blood-thinning medications by reducing their effectiveness. When effectiveness drops, clot formation risk increases. In patients predisposed to stroke due to atrial fibrillation, prior clotting events, or mechanical heart valves, that increased clotting risk can translate into increased stroke risk. The solution is not fear. It is communication, consistency, and monitoring. Anyone on anticoagulation therapy should inform their healthcare provider before making major dietary changes. Regular INR testing should accompany shifts in eating patterns. Portion sizes should remain relatively stable from week to week. Leafy greens remain powerful allies for most people. They support cardiovascular health, reduce inflammation, and provide essential nutrients. But in the unique biochemical environment created by vitamin K-dependent blood thinners, they become part of a delicate equation. Understanding that equation empowers patients rather than frightening them. Knowledge transforms a hidden risk into a manageable variable. And in medicine, especially in stroke prevention, managing variables is everything. If this opened your eyes, I want you to take a moment and reflect on your pantry. Awareness today can prevent a crisis tomorrow, because protecting your brain and your heart isn't about perfection. It's about informed choices, small adjustments, and consistent habits that keep your blood vessels calm, flexible, and strong. And that's how you truly lower your stroke risk, not by avoiding vegetables, but by choosing them wisely, preparing them thoughtfully, and listening closely to what your body is telling you every single day.